So a lot of my patients, I like to give them homework that they can do on their own when they're not here at the clinic getting treatment. It helps kind of maintain some of the relief of their symptoms that they get here in the clinic. Now, a lot of people ask me about tennis balls, right? So using a tennis ball is really handy. It's really good. What I notice is sometimes, specifically for low back, like sciatica pain, I notice that it doesn't quite get as deep as sometimes I need. For me personally, and I've had a lot of the same, I've had patients coming in and telling me that as well. It's kind of hard to get where they need to go. So I prefer to use a lacrosse ball. Now, to add a little bit of framework here, typically this is more specific to hip work and anything regarding the low back. Now, when you're addressing the deep rotators, a lacrosse ball is going to allow you to get through some of the larger muscles, such as glute maximus, right? So if you can't quite get through with a tennis ball, this guy is a little bit more dense. It's going to allow you to get through that glute maximus and address piriformis, which is actually a muscle that goes directly over that sciatic nerve and can help exacerbate some of those symptoms. The tennis ball is just collapsing, right? And it's kind of just the nature of the ball. It's supposed to have a lot of bounce off the racket, and it's not designed for having that kind of pressure applied to it. So collapses under pressure. The lacrosse ball is solid. So when you go to use the lacrosse ball, you're going to be able to get a little bit deeper into those muscles and be able to address the problem more efficiently. You know, that's kind of what I've noticed over my time working and doing rehab and stuff. So keep that in mind.